Assalamu alaikum. On behalf of Dr. Khalid Mahmoud, the Academic Secretary of Sudanese Doctors Association in Qatar, I would like to welcome you all to our activity today titled Beyond Do No Harm, Core Clinical Ethics and Ethics of Human Research. We will be going through these concepts and the topic will be covered in about 2 hours. And we are delighted to have Dr. Isameldin Abdelbagi. Dr. Isam is a senior consultant and trainer at Primary Healthcare Corporation in Qatar, and he is a clinical instructor at Weill Cornell Medical College in Qatar and core faculty in the Family and Community Medicine departments in PHCC here in Qatar. Dr. Isam will be speaking about clinical ethics addressing different professions. So without any further delay, the floor is yours, Dr. Isam.
بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين. الصوت واضح كده ولا أنا أغير حاجة؟
واضح, it's very clear.
طيب I'm grateful and thankful to SUDAC team represented by Dr. Khalid and to my colleague Dr. Mohamed Hashim for the support and for insistence to have this workshop after the first workshop that we had during the conference. And I'm responding in this presentation, responding to the questions and requirements presented to me at the end of the previous workshop. And it's going to be somehow modified to meet the needs of the people who spoke to me at that time. I have no conflict of interest whatsoever here. And the contents is going to be of my talk. This is a long list, but everyone is going to have 1 or 2 slides, and I'm not going to go deep in it. Okay, so I'll talk about what is ethics and ethics sources and concepts. I'll talk what is not ethics, because some people have some confusion. I'll talk about society benefits, society without ethics, ethics in society relationships, ethics and culture, religion, and secular authority, and biases in ethics. I'm going to talk to ethics across human life, and ethics, morals, and the law, trust in professions due to ethics, ethics in professions. You have a lot of professions, the judges, the lawyers, the citizens, the butchers, the pilots, the diplomat, the AI expert, the subordinate, the military, the politician. All of these have ethics, but I'll select examples from them because of time. And talk about the other half is going to be ethics in healthcare system. We'll talk about the ethics of the system itself and ethics of service and ethics worldwide, coming from US, UK, and EU, and others, and ethics for the professions, doctors, nurses, pharmacists, and others. Now we have about 25 major sub professions in the medical field. And I'll talk about ethics and quality improvement science, quality improvement project audits and evaluations. And I'll talk about ethics of revalidation and ethics of accreditation, ISO, JCI, or ACI, Accreditation Canada International. And also I'll talk about ethics of education under and postgraduate. And this is for medical field. And ethics in public health and legal and social aspects and emerging technologies. And then Dr. Mohamed will talk about ethics in research. And then we go into ethical dilemma, and I prefer that you send me your own dilemmas before I give you my dilemmas. What is ethics? What is not ethics? The 6 lenses decision making. What does ethics mean to you? There was a survey which was done by Santa Clara University some time ago, and they came to see that ethics has to do with what my feelings tell me is right or wrong. Ethics has to do with my religious belief. Being ethical is doing what the law requires. Ethics consists of the standards of behavior our society accepts. I don't know what the word means. These replies might be typical of your own. This was a survey which was done many years back, and it came out with these answers. So, what is ethics? Ethics is a system of moral principles. Moral principles. That includes idea about ideas about right and wrong, and how people should or should not behave in general and specific cases. Ethics, at its simplest, ethics is a system of moral principle and is also described as moral philosophy because many philosophers were behind the concepts of ethics. They affect how people make decisions and lead their lives. Ethics is concerned with what is good for individuals and society. The term is derived from the Greek word ethos, which can mean custom, habit, character, or disposition. This is from the BBC survey and work on ethics. What is ethics? Ethics covers the following dilemmas: how to live a good life, our rights and responsibilities, language of right and wrong, moral decision, what is good and what is bad. Our concepts of ethics have been derived from religion, philosophies, and culture. They infuse debate on topics like abortion, human rights, professional conduct. What is ethics again? Ethics is a study of what is morally right and wrong, or a set of beliefs about what is morally right or wrong. It's either a study or a belief, okay? And ethics refer to both moral principles and the study of people's moral obligations in society. The word ethics is also derived from the Greek ethos, okay? And then we have the legal context. Ethics defines how individuals choose to interact with one another. And in philosophy, ethics defines what is good for the individual and for society and establishes the nature of duties that people owe themselves and one another. This is from Law School of Cornell University. And this is highly affecting the American laws. What is ethics? So ethics is a set of moral principles, a theory or system of moral values. B, the principle of conduct governing an individual or a group, professional ethics. A consensus of moral importance and a guiding philosophy that is a set of moral issues or aspects, such as rightness. Also, it is a discipline dealing with what is good and what is bad, and with moral duty and obligation. This is from Merriam-Webster Dictionary. This is from the language. Ethics is, again, it's a moral philosophy. It is morals, it is values, and it is virtues. Okay? This is also what is ethics. Again, what is ethics? Ethics is a branch of philosophy that explores and analyzes the nature of morality and our moral behavior. It is a systematic study of what is right and wrong in our actions and the impact that our actions have on others and on the society as a whole. Okay, and finally, ethics help us make moral decisions and understand our obligations and responsibilities to each other. It is helpful to identify what ethics is not. Ethics is not the same as feelings. Feelings are something different. Ethics is not the same as religion. Religion may have something in some areas may consider unethical. Okay. Ethics is not the same thing as following the law. The law is different from ethics. We will come to that later. Ethics is not the same as following cultural accepted norms, because culturally accepted norms in one society may not be accepted in another society. Ethics is not science. It is a social science. It is not, you can say it's a social science or social norms, but it is not exactly as science. It is not like chemistry. Approaches to ethical decision making, which we call the 6 ethical lenses. Number 1, we have the utilitarian consequentialist approach, the one that is calculating the consequences. What are the consequences of what I choose or what I do or the habit I do or the custom I take with my life? And then the right approach is about the rights for people. The fairness approach, it is about justice, fairness, and equity. And then the common good approach, what is common for the biggest number of the population. And the virtue approach about ethics and virtues. We come to virtues later on. Virtues come from society and come from religions as well. And then the care ethics approach. Care ethics, the duty of care. What does it tell you to do? So when you take a decision, you are following one of these 6 lenses. And when these 6 lenses contradict or come in contradiction with each other, that is a place where dilemma comes up. Okay, we have subtitles or subfields of ethics. We have the descriptive or behavioral ethics. These are the ones that ask how people behave in real world, okay, and the psychological factors affecting them. The normative ethics ask how ought people to behave and why. And we have the meta-ethics or metaphysics ask for the rules for judgment of behavior or judging a behavior. We have the applied ethics refer to applying ethics to real world problems. Okay, and we have the group ethics ask what factors enable and inhibit individuals from working together to do good. Okay, and this is mainly when you are dealing with a society and individual behavior within a society. So, what is ethics? Ethics is based on well-founded standards of what is morally good and bad, and morally right and wrong for the society. Ethics establishes the rules that individuals need to follow for the survival of the society. Survival of a society. Therefore, ethics are subjective and communal. An ethical behavior is an action that is following the rules of what is considered correct in a society. On the contrary, a moral behavior is driven by the desire to be good. Okay. The community need for ethics. The role of ethics, society benefits, society without ethics, ethics in society relationships, ethics and culture and religions. We are going to touch on this. Okay. Ethics is a set of moral principles that govern the behavior of individual or a group. So we're coming to the group. It involves distinguishing between right and wrong conduct, good and bad actions, and the moral values that guide our decision making. Ethics help us make choices that contribute to the well-being of individuals and the society as a whole. According to the Stanford Encyclopedia of Philosophy, ethics is the systematic reflection on what is moral. Ethics is essential for several reasons. Why? Why we need ethics? Why is it essential? Because it provides a framework of how individuals should behave in various situations. It promotes trust and cooperation among people and within organizations. This is organizations for work or society or pressure group. Okay? It helps maintaining social order and promoting harmony in society. And also it serves as a moral compass to guide the decision-making and actions within individuals and within the society. So what is the role of ethics in the society and medical profession? In the society, ethics play a crucial role in guiding individual behavior and prompting mutual respect. If you know that everybody is going to behave well, this will improve your respect to the community and to the individuals. Vice versa. Upholding justice and fairness in interactions between individuals. We need justice, we need fairness in any community to survive. Setting standards for acceptable conduct, and promoting social responsibility. Without ethics, we cannot have these three. We will not have mutual trust. We're not going to have good interactions between individuals, and we're not going to have acceptable standards to all people. In medicine, okay, in medical profession, it ensures patient safety. It upholds the principle of beneficence, doing good, and non-maleficence, avoiding harm. So we'll be doing good and doing no harm, and people will trust us for that because we're doing this one. For every. So we need it. So we don't want to lose the rest of our community. Okay. What are the ethics required from a citizen? The normal citizen. At least 10 are required from him. Number one, honesty, integrity, respect, responsibility, fairness, compassion, loyalty, civility, courage, empathy. We want every citizen in the community to behave in accordance with these ethical entities. Every citizen must respect these, okay, ethical entities. Okay, let us see examples of the worst unethical deeds in human history. The first example is slavery. When the Europeans started the triangle trade from Africa, taking people to go to America, people just captured, caught by the weapons, and then they take them and they enslave them. And they make them to work very hard, okay, in America, and once the product comes, they take the product to Europe. Again, the second one was the Rwandan genocides. About 800,000 Tutsi were killed. Twice. Also the Hutu were killed in there. And then we have the Khmer Rouge regime, which has killed about 1.7 million people. They killed them because they were not in accordance with the government. And we have the Trail of Tears for the Indians in North America. You know, they have killed about 60 millions just to take their land. Imagine how this white man was unethical for killing people to take their land. Okay, ethics required in community relationships. Okay. Ethics play a vital role in society relationship by setting standards or behavior interactions. In any society, these are the ethics of relationship. Respect, honesty, integrity, empathy, fairness, responsibility, confidentiality when appropriate, tolerance to others, people who are different than us, and communication. With this, these are the least ones. There is another longer list, but I chose this one for the sake of time. So any community to have healthy relationship between people must exercise these ones and do them all in the right way. Okay, what about religions? This is a Judaism, Christianity, Islam, Baha'i faith, Hinduism, Wicca, Taoism, Confucianism, Jainism, Buddhism, all of them talking about a golden rule of reciprocity, treat others as you would like to be treated. And this is the background of the virtues that comes from religions. I will take you to some Islamic morals and ethics here. Number one is Tawheed, charity and generosity, humility and modesty, honesty and truthfulness, compassion and kindness towards others, patience and perseverance, justice and fairness, respect for parents and elders, forgiveness and mercy, gratitude and thankfulness. This is morals and ethics at the same time from the Islamic religion. Also, we have the virtue ethics in Islam and in Christian approaches. And these are good for doctors. Honesty, compassion, respect, being non-judgmental, courage, benevolence, conscientiousness, confidence, humility, empathy, trustworthiness, self-awareness, enthusiasm, professionalism, personable, altruism, discernment, and integrity. Islamic bioethics is an extension of Sharia, the Islamic law, and it is founded on two foundations, the Quran and the Sunnah. Both of these two are putting the Islamic law and Sharia, and this is affecting all the ethics and the laws that is applied in the state of Qatar and the nearby countries. Okay, what about secular authority? We spoke about the religious part, but the secular authority have a different arrangement. For example, in the United States, we have the federal government law. This comes on top. And then the state government law, this is number two. And then we have the national policy, which is issued for all clinicians regardless of the type. And we have the national policy issued by a specified type of clinician. So all doctors will have national policy, family physicians will have a special policy, obstetricians will have a special policy, so on. And we have local policies, which comes from the state in the United States. And then we have the health care organizations ethics committee. Every work you have or every place you have, every organization will have its ethics committee that's going to lay down the rules. And then we have the healthcare organization employees according to hierarchy on the organization chart. Organization chart will put you in a specific type of ethics. Ethics for a strategic planner is not ethics for the middle management, is different than the ethics for the subordinate. So this is the secular authority, and which is always guided and guarded by the law. If you break them and cause harm, you will go to the law side of the ethics. What about the biases? People deviate from ethics when they have egoism, when they serve oneself first. If somebody puts himself first, he may break down some ethics and some rules as well. Those who have altruism, those with altruism, they serve the other first. Serve the other first, on the contrary of the egoism. And then we have the cultural relativism, and who serves one society or other social groups' expectations first. So there is preference for a group or a culture or a society here. And we have subjective relativism. Let each person, they have this concept that let each person decide for oneself what interest to serve. So if we leave people to do this, sometimes they may breach the altruism. They may go for egoism. And then we have the virtuosive. People like to follow certain virtues. They have the right to do that, provided that they do not harm other people. And then we have the duty or deontological ethics. It is to adhere to the most relevant authority or rule in making decisions. Okay? Many things are there, but you choose to follow the duty. What is the duty of a doctor? You do the duty of the doctor. You don't care about the results. Only you do the duty, like applying a protocol. And then we have the consequentialism or utilitarianism that is focuses on the results. If I do this, what will be the result? If I do that, what will be the result? And then I decide on that. And then there is the rule utilitarianism, and what focuses on the means, the ways you use to reach a certain policy. Okay, but it always looks for a uniformity. They want things to go in a uniform manner, not to be scattered by, especially in one organization. I put these flowers to give you some rest to catch up your ideas, to catch up your mind. Okay, now we go to the morality. Morality is a person's or society idea of what is right or wrong, especially in regard to person's behavior. Maintaining this type of behavior allows people to live successfully in groups and society. That's it. They require a personal adherence to the commitment of the greater good. Morals have changed over time based on location. For example, different countries can have different standards of morality. And the best example here is homosexuality. Okay. Let us see other morals. Bravery, fairness, defer to authority, helping the group, loving your family, returning favors, respecting others' property. Imagine we apply this in a society, and imagine we ignore them in a society. How would life be? They do affect the society, they do affect the profession, okay, and affect the reflection from the community and individuals to us. Okay, what is the difference between ethics and morals? Ethics are rule of conduct, while morals are personal principles. Ethics stem from society of profession. Morals arise from individual belief. Ethics can vary based on the context. Morals tend to be more fixed across situations. Ethics are external guidelines. Morals are internal values. So we start by our morals, and then when we go next, we go to the ethics to obey the rules, because this is a personal principle and this is our rules of conduct. Now let us go to ethics and the law. Source of rules in ethics is moral principle, while in law is legal statutes. Enforcement of ethics by self-regulation and societal norms, maybe societal regulations. But law is enforced by legal authorities, the judges, the police, okay, and these people. Flexibility, ethics is adaptable to moral dilemmas. Laws are often rigid and formal. Okay, scope, it's guiding behavior, but law is regulating the conduct. Okay, consequences, social and personal impact, while in law, it is legal repercussion. Okay, so there is difference between ethics and law, which we need to understand, okay, for living peacefully and safely with our laws. Don't be under the law. If you break the ethics, you may cross and be under the law. Don't break the ethics, okay, because it might take you to the other side. Okay, ethics across human life. We have ethics of fiancé, marriage, pregnancy, childcare, adolescent care, friendship, schooling, education, university education, employment, evaluation, promotion, termination, aging, geriatrics, illness and death, funeral, burial, cremation. All of these has ethics for all parties, okay, contributing or being around this, okay. We'll take some very few examples, not much. Ethics for a fiancé, honesty and communication. There is too much lying in this time. Too much dishonesty here. Okay. Honesty and communication, respect, trust, loyalty. There is big questions about loyalty. Integrity also. Compassion and empathy, responsibility, consent, and support. These are the top 10. There is still more in the list, but what is happening now in our societies? There is a lot of breaches for this relationship. What about requires for marriage? Honesty and trust, respect, communication, commitment, empathy, mutual support, fairness and equality, forgiveness, personal growth, shared values and goals. Also, we're having a lot of problems in this relationship. Either the two parties or one of them is breaching these ethical conducts. Right? For what about the child care, upbringing of children? Ethics, these are 10 ethics here. Safety, respect, non-discrimination between male and female or those who are able and non-able. Confidentiality, you keep their secrets. You don't talk about them when they get older. Empathy, professionalism in interactions with children. Communication, child-centered approach. It is just like patient-centered approach. Continuous learning and boundaries. We need to observe this when we are doing child care. Okay? And what about friends' relationship? They should have trustworthiness, respect, loyalty, empathy, communication, integrity, fairness, confidentiality, forgiveness, and supportiveness. Many friends are doing this, but still we're having some areas where we are lagging behind. Okay? What about employment? When you go for employment, these are the ones which is required from human being across his life. Honesty and integrity, respect, confidentiality, professionalism, accountability, fairness and equity, sustainability, conflict of interest, compliance with laws and regulations, continuous learning, and improvement. This is for any employee working wherever he works, whatever his job he takes, because he's serving the community. This is about civil work, okay? Integrity, accountability, respect, impartiality. You should not be impartial, okay? No favoritism to no biases, objectivity, confidentiality. You keep the secrets, whatever you know in your job, okay? Professionalism, transparency, compliance with laws and regulations, and personal conduct has. You have to maintain a positive work attitude and avoid behaviors that could harm the organization's reputation. So these are ethics which are required in civil work, okay? We have ethics of this, and we have a long list of things that whoever moving in the community should have his own ethics. Trust and professions, relationship to ethics. Let us see what's going on. When you go to Statista, the nurses scored the top. They have very high trust by 79% of the population screened. Okay, this is 1,020 US adults, 18 plus, surveyed in November to December 22. This is by Gallup. Gallup, this one of the institutes that work on statistics. They found that nurses score the top, and they have very low about when you are talking about distrust. Okay, but 79 of people trust him. Next to them come medical doctors, and then high school teachers, police officers, judges, lawyers. Who got the list? Huh? Members of the Congress got the list. 62 said they don't trust them. They have very low or low trust on them. Only 9% trust them. What about the telemarketers? Okay, those who sell things about by the internet. Okay, 59% of them scored low to very low. Okay, so community have their say on the trust of the other community. And if you look here also, nurses scored 82% trust, military officers 71, grade school teachers 66, and then medical doctors 65%. The list is lobbyists, business executives, lawyers 18%, TV reporters 23. This is amazing. Okay. All right. Trust in a profession. Trust in a profession is built on competence, caring, consistency, and transparency. Mistrust stems from dishonesty, lack of follow-through, micromanagement, and poor communication. Okay? Factors like past negative experiences, uncertainty, and lack of empathy can also erode trust, leading to negative outcomes like reduced collaboration and disengagement. All right, causes of trust. Why should people trust a profession? Why should people trust us as medical profession? Competence. We should be competent in what we are doing. Caring, commitment, consistency in service, transparency, accountability, open communication, and reliability. These are the factors that leads to trust. What about mistrust? Dishonesty, lack of transparency, poor follow-through, disrespect, inconsistent behavior, micromanagement, unaddressed issues, and job uncertainty. If we show any of these, we are inviting the community to mistrust us or to distrust us. Okay, least trusted professions. Who scored 67%? The top. Politicians are the least trusted one. 2 in 3 people say politicians are the least trusted profession. Over half of the population say that government ministers are not trustworthy. You see? Also, people don't trust advertising executives. 46% don't trust, 57%, 46% don't trust him. Clergy, priests also is not trusted, and bankers is not trusted by 41% of the population. Those who did this was done by 19,000 adults pulled into 26 countries in 2018. This is across many countries. So politicians are the least to have trust. Ethics for professions. All professions has their own ethics required by the community. Okay, this is for West Point. This is one of the biggest military college for the U.S. Military Academy. The cadet honor code: a cadet will not lie, cheat, steal, or tolerate those who do. This is on the wall. They put it there. Okay, let us say the cadet ethics. This is the cadet. He's starting army, very interested. Telling the truth, acting with fairness, upholding institutions, standards, treating others with respect, and taking responsibility for one's action. And this includes protecting others and reporting wrongdoing. Core principle: truthfulness, integrity, respect, discipline, and loyalty. So this is what expected from a military cadet. This is what is required by the Chinese army. Loyalty to the Communist Party of China. This is number one. Obedience to order. Number two. Discipline. Three. Four. Patriotism. Honesty and integrity. Professionalism. Respect for human rights. Courage and sacrifice. This is required by the Chinese army. Wow. What about this is a football player? They have 10 ethics. They should always respect the fair play, integrity, dedication, discipline, teamwork, respect, humility, responsibility, health and safety, community engagement. This is what is required by a football player. What about artificial intelligence expert? Ethics required from him are the following: transparency, accountability, fairness and bias mitigation, privacy and security, human oversight, consent and user empowerment, social responsibility, professional integrity. What if they do not respect this and cause misleading of all the people who are using artificial intelligence? This is for a judge. What about the judge? The people who apply the law. They have these ethics. They have longer than this, but I choose this 10. Impartiality. They should not have any favoritism to one person or another. Integrity, independence, fairness, confidentiality, respect, diligence, professionalism, impartiality, continuing education. Okay? So we have two types of impartiality with Zambia. This is for the judges. Okay, what about the politicians? Those who scored very low interest from the all populations. Honesty and integrity. Are they honest? Politicians in our world? I doubt it. So honesty and integrity, accountability, fairness and equity. Are they fair? Treat people equally? Are they accountable to what they do? They escape? Respect for the law. Do they respect the law really? Conflict of interest. Do they declare their conflict of interest? Okay. Respect for human rights. Do they really respect human rights? I wonder. Public service. Are they serving the public or serving themselves? Transparency and openness. Are they open or hiding so many things? Respect for the diversity. Do they respect diversity? Okay. Environmental responsibility. Do they pay attention to the environment? I think our politicians are violating all the ethics required from them. Ethics for healthcare system. It's the time now. Where is my watch? Okay. Now we go to our healthcare system. For healthcare system, we have the principalism, the four things: autonomy, beneficence, non-maleficence, and justice. And they has appeared in all the healthcare professions, but they decide them. We have key ethical consideration for the healthcare system. Number one is the informed consent. Number two is confidentiality and its breaches, the resources allocation, the medical research issues, and end-of-life care. And the current emerging challenges are technology, the equality, and the provider well-being. Providers are getting under a lot of pressures now, so it's becoming an ethical challenge to the healthcare system as a whole. And this is why they are working on it hard nowadays. The second way, ethics across the world. You know, these are Tom Bishan and Childress. They are the people who wrote these four principalism or the four principles. These are the cornerstones of ethical decision making: autonomy, non-maleficence, beneficence, and justice. These four. No one should forget this. All four underscores human rights, particularly with respect to patient care. These four values also apply to solitary confinement and mental health concern. So these four are top in all ethical issues in the healthcare system. and they are coming and agreed upon by the UK. Actually, these are two Americans, but they published their first book in the UK, and then the European Union adopted that. We have core principles for general ethics. Okay, number one, the golden rule is utilitarianism. That is golden consequence. What is the best at the end? And then we have the golden mean. What is the best course that balance between the two extremes? And the principle of non-maleficence, empathy and solidarity, and honesty and integrity. These are core principles for general ethics we need to observe what we do. The 10 duties for us: do not kill someone, do not cause pain for someone, do not disable someone, do not deprive someone of freedom, do not deprive someone of pleasure, do not deceive someone, keep your promises to someone, do not cheat someone, obey the law, do your duty. This is from Mike Leon and his group by the National Library of Medicine and agreed on. Okay, ethics required for quality of care and safety. 6.6, respect for autonomy, beneficence, non-maleficence, justice, integrity, accountability, and responsibility. These are ethics for safety, so quality of care and safety. Ethics for quality improvement project. When you go for quality improvement project, you have to observe autonomy, beneficence, non-maleficence, justice. You have to go for, when you go for operation and data governance, risk assessment, remember to do it. Data privacy and confidentiality, informed consent, and scientific validity. These are guiding any quality improvement project. Organizational considerations, you should have clear protocols, staff training, and transparency. This when you are going for quality improvement project. Other ethics when you are going for audit, medical audit. You should observe the core principle ethics following the integrity, objectivity, confidentiality, competence, and due professional care and professional behavior. For practical ethical consideration, remember minimal disturbance, staff knowledge, data protection, independence, and continuous learning. When you want to do an audit, okay, you have to observe these ethical principles. Okay, when you go for revalidation, you remember we had the Irish revalidation few years back. They came to evaluate all the doctors working here. So there is an ethical framework which was done by the General Medical Council and which exactly applied by all the other bodies, similar bodies in the world. Okay, they have 4 domains. The first domain, okay, knowledge, skills, and performance. The second domain is safety and quality. The third is communication, partnership, and teamwork, and then maintaining trust of all people around you. And when they come and do revalidation of somebody working in the field, they will end up with one of the 3. Either they revalidate, or they defer, or withdraw the license. So when they do this, they have to do it and observe all the ethics that is needed, which are here. These are the ethics of revalidation because they make difficult decisions on people. First, they should be considered about public protection. So if a doctor is missing one of the domains that affects the public protection or affects the professionalism, or affects accountability, or affects patient-centered care, or affects continuous improvement and integrity, then they might hold his license or discontinue the license. Okay. What about ethics of accreditation? The JCI, the Accreditation Canada, and the ISO. What about that? Core principles are the following: integrity, objectivity, professional competence and due care, confidentiality, and professional behavior. Also, there is ethical consideration in the accreditation process, which are accountability, fairness, respect for individuals, and protections of rights. All right? And how organization can meet ethical standards for accreditation? They should develop an ethic infrastructure. They implement clear policies, conduct regular assessments, ensure compliance, and address issues promptly. These are what's the ethical core principles and the consideration and how organizations can handle the standards of ethics when they are going for JCI or Accreditation Canada or ISO. Okay, ethical challenges and dilemma. This is for undergraduate education. Okay. For undergraduation, we should consider the following: balancing training and patient welfare. Number two is student responsibility. Number three, the hidden curriculum through the education and the ethical conflict that might arise. Okay, so we should observe these four dilemmas and challenges when we are doing undergraduate medical education. The objectives of ethics education is to help students understand and apply ethical principles, to equip students with the values, social perspective, and interpersonal skills needed for medical ethics, to promote professionalism and a strong sense of ethical responsibility. Okay, this should be put on them, growing with them from the college, and to prepare students to handle ethical dilemmas. And number one to do is to ask for advice from their supervisors, because they are still students. What about ethics for the postgraduate medical education? Okay. The key areas we focus on postgraduate training is patient-centered care. This is the ethics number one for the residents: confidentiality, informed consent, professional integrity, conflict of interest, and health equity. Residents should observe this. The challenges will be translating theory to practice, because they study a lot of theory, and the challenge is how to transfer it and how to translate it into patient service, and promoting self-reflection, need for continued education, and assessing effectiveness. Residents should be concentrating about these for ethical educations. Okay. Public health, it have a lot of a long list. I will leave it now. Okay. What about legal and social aspects? We have to think about dealing with legal issues like malpractice, negligence, and any kind of harm. Any kind of harm that happens during your work might take you to legal implications. Addressing legal aspects of issues like organ donation, euthanasia, termination of pregnancy, do not resuscitate. Navigating cultural and societal beliefs surrounding health care. Okay, many things are in this area. We'll come to it in our next workshop. And emerging technology is my final slide, I think. What about artificial intelligence? Can we depend on it for diagnosis and choosing of treatment and doses and so on? What about the genetic technologies going on now and a lot of advances there, and long problems of reproductive health and the new technology which are coming? Ethics in research, and here I will stop and I will hand the screen and the microphone to Dr. Mohamed Hashim, and thank you. Please, if you have questions, you can write them. Now I will go and see the chat, and if you have any questions, you can send it into the chat while Dr. Mohamed is preparing to come. Thank you for listening.
Thank you, Dr. Assam, for the very informative session. And we always learn from your expertise and your presentations. We keep learning from you. So now I will be sharing my presentation regarding the ethics in clinical research. So in the meantime, people can write questions in the chat. And if they want to write any specific topics that are to be discussed in the last session about ethical dilemma, they can share it in the chat box. Just make anything that you share as anonymous, and Dr. Isam will be reading your comments there, and we will be responding to you back at the end.
30 29 close.
So now I'm sharing my slides, and we'll go quickly through the ethics in clinical research. I have nothing to declare. So when we go to ethics in clinical research, let's start with a quick scenario that is a fictional scenario. If we are designing a clinical trial testing a new medication, considering having 95% confidence interval, you calculated the sample size to be around 1,000 participants in the intervention group. You wanted to go for higher confidence interval, and it's feasible to recruit more. You can reach 5,000 or more because the IRB approved that you can use incentives for participants. So with the incentives, you can get more participants. So you can reach 5,000 or even more. So we just wanted to discuss if that is ethical or not. And to go on that, we just need to remember that the goal of clinical research is to develop generalizable knowledge that improves human health or increase understanding of human biology. So the path is to find out a new drug or treatment is safe or effective is to test it on volunteers. But having more people be tested more than was required will let more people be under risk. So is it ethical to have more people at risk, or you just go with the minimum sample size that can have results that are to be generalized at the end? So the purpose of ethical guidelines is both to protect patients, volunteers, and to preserve the integrity of the science. So the ethical guidelines are in place today, were primarily a response to a past abuse. So we weren't having the guidelines, but because of past abuse, we had these guidelines. So we are starting with what was developed in 1984, and that was the basic for ethics in clinical research. And it's called the Nuremberg Code, where that was adopted by the United Nations and recognized as the international common law guiding medical research. It has 10 basic principles. The most important of them were voluntary consent of subjects must be taken, and prior animal experimentation is to be done to determine the risk, and investor for nausea. So they used this medication for nausea during pregnancy, and it was effective for that cause, but it had teratogenic effect. So it has some anomalies in babies. They discovered that, and they knew that this is related to the medication, but they wanted to hide it so that they can continue selling the medication. So what they found is children with the anomaly shown in the picture here. And then investigations were done, and they knew that this was caused by the medication, and the trials were terminated, and the medication was withdrawn. So as a result of that, we had the Belmont report, as Dr. Assam mentioned briefly, and we all know that the three main concepts were autonomy, beneficence, and justice. After that, in 1964, again, as a result of that, we had Declaration of Helsinki in its first version, where it outlined the basic principles of human experimentation, and they required informed consent of study subjects. You tell them about anything that is related to what they will be going through. If any expected side effects or reported side effects, they need to know about it, and any risk that they will undergo, they need to know about it. And then ethical approval what is mandated from that time. We had another version of the Declaration of Helsinki. We'll go through it shortly. And it went through some updates in 2014. And then in 2016, we had another declaration, which is called Declaration of Type A, after we get what's called the biobanks and issues related to health databases. And then in 2024, we had the final version of Declaration of Helsinki, the latest one. So let's just go through another scenario. Assume that you have a 19 years old patient who asked to meet you specifically because he heard that you have expertise in clinical research and its regulations. He explained that when he was 8 years old, he underwent a surgical operation. At that time, his parents gave consent for some of his blood and tissue samples to be collected and stored in a biobank. Since then, those samples have been used for research projects. And he believed that ongoing studies are still using them. Now, as an adult, he tells you, I don't want my samples to be used in research anymore, even if my parents agreed in the past. I don't even want my data to be linked to any future publication from today onward. What can I do about this? Just put in your mind that his parents got an incentive as well when they accepted participation initially. So before the declaration of type A, that was like a gray area. People weren't able to clearly respond to it. But with the declaration of type A, they stated clearly that they have the right to withdraw their consent. So when a person who were not able to consent, whose data and biological materials have been stored for future research, attain or regain the capacity to consent, reasonable efforts should be made to seek the consent of these persons for continued storage and research use of their data and biological materials. That is applied for the identifiable data, but if there were any data that were de-identified, then you can't link them back to the participants, so you can still go. But if they can be identified, they have the full right of retaining that. So they can alter their consent and they can pull their data from the biobanks. So we come to another point, that's a practical point when we are conducting the studies and the types of consent that we can use. So we do have the most famous one, which is the informed consent, which is voluntarily documented agreement to participants after receiving full study details, the purpose, procedures, risks, benefits, and rights. So we used it as standard for adults with full capacity. Just like an example, another signing a consent before being enrolled in a clinical trial. What else we have is the assent. The assent is when a child's affirmative agreement to participate appropriate to their development level, but this should always be paired with parent or guardian consent. So you get the assent together with the consent from the parents or guardian. So this is for children, for example, at 12 years old, to be enrolled in a trial, the assent from the child, but the consent is still there from the parents. So when we go for waiver of consent, so this needs a formal ethical or IRB approval to conduct research without individual informed consent. This goes whenever there is a minimum risk for study participants when obtaining the consent is impractical. For example, you want to go for retrospective data or charts, or if you want to go for a data of a patient who's not currently available in the area where you are conducting the research, but that will carry only what's classified as minimum risk. Verbal consent, it goes with people who are illiterate or when you are doing like a telephone interview. Usually with verbal consent, you need either recording or a witness to be there. So we go to another famous trial that was done in the United States, where the map is pointing here. That was in Macon County in Alabama, the city of Tuskegee, the famous Tuskegee trial that changed a lot in the ethics of clinical trials. This was conducted in 1932, where we did have like 600 Black Americans enrolled in the study. Almost 400 of them, 399 were having syphilis, and the other 200 were like the control. So the Federal Public Health Services began this study to study the natural effect of syphilis in African Americans. And initially, the study was planned to continue just for 6 months. And the subjects received free medical exams, free meals, and prior insurance, but nothing to treat their disease because they wanted to study the natural history of disease. But instead of 6 months, this trial continues for 40 years till it was terminated in 1972. And we know that penicillin was discovered and was proved to be effective, but they hid this from them and they allowed them to continue without medication till they die just to study the natural history of disease. So then New York Times wrote about it and the government terminated it. Unfortunately, they said when they did the investigations, the principal investigators were already died because it was 40 years after initiating the trial. So the ones who started it were not like claimed as responsible. So that was in 1972. And they waited till 1997 till Bill Clinton, the president of the United States at that time, declared what has happened there. He met with the remaining people who were there in the photo. These were the remaining people from the 600 participants of the trial. He brought them to the White House and he apologized officially about what has happened. And he stated that what was done cannot be undone, but we can end the silence after a very long time. So the ethical guidelines in place today were primarily a response of past abuses, the most notorious of which is, in America was the experiment of Tuskegee that we stated here. As a result, we had in 1974 the National Research Act that brought to us the new concept of institutional review boards that are there to give the final approval for clinical trials and continuous review of trials that are ongoing. And we had in 1996 the HIPAA for confidentiality and probability, where they added more like rules to keep the privacy of individuals and their data and research. So another point that we always need to consider is the plagiarism whenever we are writing a proposal for research or later on manuscript writing. So it's based on regulations where a percentage is accepted beyond which your writing is not accepted. And one of the other issues in clinical research is authorship that bring lots of conflicts either initially when they start developing a proposal, doing the research, or when they go at the end for the publication step. So the main advice is that people, they usually agree on authorship and sequences initially, and they visit this whenever they meet at any stage, and they will see if people are doing what they were supposed to do, then they will continue with the same sequence. If not, then they need to revisit if they're still meeting the criteria for being authors or not. So who's an author? Based on the International Committee for Medical Journal Editors, is a person who does have substantial contribution to the concept of design of the work, to the acquisition, analysis, and interpretation of data of the work, and drafting the work or revising it critically, and final approval of the version to be published, and agrees to be accountable. So it's all these criteria. So it's the four together. If one of them is not there, then the person will not be qualified to be an author. So dispute happens always when the people are not having clear roles for people, and they're not revisiting these roles every now and then. So we have other terminology that we use, what we call ghost author, guest author, and gift author. So from the word itself, gift author is when you put the name of a person who did not contribute or did not have substantial contribution, just for another benefit, or a ghost author. And again, from the word itself, a ghost author is the person who did have substantial contribution, but his or her name is not there. So a person who developed a research proposal fully, for example, but was not acknowledged and was not part of the research team later. And a guest author is a person whom you add his or her name just because of the value of their name when it's added to you, when you want to submit, for example, for a journal or so. So all these three are not ethical to be used. So we need to avoid these three. So we just go through this paper, and it's related to the use of AI in clinical research. We don't have clear regulations for the use of AI, but the main advice is always in clinical research, don't use the AI tools that are available so far to develop content. You can use them to like rephrase things or so, but not to develop content. And this is an example of persons who used it in a way, and this paper was published. And if you look at the introduction, it starts with what they stated here as certainly here is a possible introduction. It seems they used an AI tool on developing their introduction, and they did not notice that one. So the point was they did it, and again it passed the reviewers in the journal, and it was published, but later on it was retracted from the journal. And with that one, there was some regulation even for the reviewers, that the reviewers are not allowed to use the AI when reviewing the articles, because when they were assigned as reviewers, it was because of their role as experts in the field in that topic, to so that they need to review themselves and not to use another tool to review it. So we can use the AI, but as like an assistant to review things and not to develop. And we must always be the experts when developing the content to go through this one. These are some AI detectors. I'm just bringing at the end so that you might just use them. These are free tools you can just use to check if the content that you develop is in a way related to AI or not, so that you can modify it. And with that, I think I'm coming to the end, and I will handle the mic again to Dr. Isam to continue. I will be having questions at the end. Thank you all.
Hello, assalamu alaikum.
وعليكم السلام Dr. Isam. I will
شكرا
just stop
جزيلا
sharing.
دكتور محمد. We are talking calmly about very serious issues.
I stop sharing, and the floor is yours back to Isam.
I think we can open the floor for the people if they have dilemmas they want, or I will present one of the great dilemmas which we met here, which could happen in Qatar. Let us say could happen. Can people unmute themselves, the audience, and they can ask questions or raise dilemma, because the next part of our presentation is a dilemma. Anybody raising his hand?
I think Dr. Mohamed Bella is wrote there in the chat.
In the chat, there is a question. Oh, I want to see if there is.
Could you share any
Hello?
common challenge? Mohammed, open his mic. Yes, Mohammed? Or who open the mic? Yeah, you can proceed.
Could you share any common challenges in applying ethics in primary care? Common challenges in applying ethics in primary care is related to the patient requests when they are in conflict with the interest of other people.
يا مصطفى ها
Hello, Naam, Mustafa. The commonest one, it was in the past, is a request for confidentiality when there is strong reasons to breach the confidentiality. This is very difficult, and I can give you some example. The first example, which was came up. Naam? Okay. The very example that came up, that when a pilot, traveled away and he came up infected with gonorrhea, and he was in the early stage and he slept with his wife. And his wife was pregnant 7 months.
ده
And
ده
then,
الستار
hello?
السلام عليكم.
عليكم السلام. عليكم السلام. تفضل.
ازيك يا يتكلم معك اسماعيل الشايب. كيف حالك؟ صحتك وعافيتك؟
أهلا بك،
الأهل
مرحبا.
كلهم بخير إن شاء الله.
الله يسلمك، الله يكرمك.
اسماعيل الشايب بتاع الملا زمان مع فيصل مراد. بارك الله فيك.
الله
كيف
يسلمك،
أحوالكم؟
تفضل.
الله يعزك. احنا سعيدين جدا و thank you for يعني your highly informative and comprehensive lecture. والحقيقة عندي بس سؤال واحد. أنا دول مهتم بالnutraceutical and lifestyle medicines which are emerging innovative emerging types of medicine now. What's the ethics required for these two areas of medicine? Nutraceutical medicine and lifestyle medicine as pertaining as regards the complementary and integrative medicine, which is now an important issue in the medicine field, in medical field. Thank you.
اوكي، مرحبا الاستاذ الدكتور الكبير اسماعيل الشايب، الاستاذ بالجامعات السعوديه، حياك الله. نحن طبعا we have 7 options in medicine. Okay, the 7 options is medicine. for treatment and management of every patient, and these are the options for the patients and the doctor. Option 1 is do nothing and leave it for nature. Option 2 is mother and grandmother pharmacy. Option 3 is lifestyle modifications and medicines. Option 4 is medicines. Option 5, surgery. Option 6 is complementary and alternative medicine. And option 7 is more than one of the above at different times. So this is part of daily practice of every physician and everybody working in the healthcare field, because this is what people are expecting to have, and this is all are concerned about the autonomy of the patient to choose. And the other thing comes, so autonomy comes first, because this is the autonomy of the patient. He wants this modality of the treatment, or he wants that one. Number 2 is beneficence. Beneficence should be well known, well studied, and with evidence-based approach. Okay, evidence-based approach or evidence-based practice. Non-maleficence, none of your interventions should cause harm to the patients. Okay, and finally, you should provide it justly to your community. So there should be no favoritism to one or other party in this medicine. So the same principles that apply to medicine applies to complementary and alternative medicines and applies to lifestyle medicine, and whatever treatment is going to be given to the patients is staying within these 7 options. Okay, so it's the same ethics. Okay, any other question, please? Okay, the second question is common challenges in applying ethics in primary care. The case I mentioned, a pilot coming back. Okay, he was infected with in early stages of gonorrhea. He had sex with his wife. She got infected, and he came to the doctor in primary health care and said to him, "My wife is coming to you for antenatal care follow-up. She will come after 2 hours." And he asked the doctor to give her treatment for the gonorrhea, for saving her and saving the child from the consequences of gonorrhea in pregnancy. But he asked you not to tell her that she is having the infection, and he's asking you to keep that confidential between you and him. And he's asking you to do whatever investigations for her to check whether she's going to get syphilis or going to get HIV in the future. He's asking you to do this test for him and for her when she comes. And if there is a way to do it on the baby, do it also. He's asking you to do it. So here, this is his request. He's asking these things. What will the doctor do? Can the one who asked the question share the answer with me? Okay. This is a dilemma. If he treats her without telling her, this is breach of informed consent. If he does not treat her, this is negligence. If he tells her, he will be angry. She might go into divorce. You are going to disrupt the family. Okay. And if you don't, if you treat her without telling her, there is a problem. If you treat her, if you tell her, you are starting another problem. And if you tell her, you will have a problem with him. Okay. So what will you do? Any other body have a dilemma or a questions? So I gave you example from primary care, real life. Or I can take you to one of the dilemmas which we may get. Can I share my screen with you? Can you see my screen?
Yes, we can see.
Okay, I'll take you to one of the dilemmas. How much time we have now? This is a family. We have Noura, the wife, here. Okay. She has very mild form of autism. And we have Ahmed, her husband is here. And we have Jabir, her father, who is here. And he's the uncle of Ahmed. And we have Sami, the child with Duchenne muscular dystrophy. This is Sami. Okay. So the case, Mr. Ahmed Jah, this family presented to your clinic in a nice morning. They have booked 4 slots, each by 15 minutes, so they have 1 hour with you. After the rapport, Mr. Ahmed, the husband, started. You know, doctor, we have a child with progressive muscular disease. We agreed on no more kids. My wife missed her pills, and we are afraid that she is pregnant. Please test her for pregnancy by both blood and ultrasound scan. And if she comes to be pregnant, we will go for TOP ASAP. We'll go for termination of pregnancy. Okay. Okay. So this is the first request. He's asking you test her for pregnancy by both blood and ultrasound. And the second request is that he's asking you to go for termination of pregnancy as soon as possible. This is from Mr. Ahmed. Mr. Jabir, the father of Noura, okay, he said, you know, doctor, she has autism. And he added, as her father, I agree with Mr. Ahmed. Mr. Ahmed added, if she wants to keep this marriage, she must go for a bilateral tubal ligation immediately. So they have a third request here, is to go for bilateral tubal ligation and immediately. Ms. Noura kept silent, but she gave you a health card showing that she is a case of very high functioning autism, near to normal. This is from her physician. And then she whispered, my last cycle was 7 days ago. I want a second baby. If one is sick, the next will be healthy. So the request for, she wants to have a second baby. Think critically, who wants what? Mr. Ahmed requests pregnancy test and ultrasound. Also, Mr. Ahmed is asking for termination of pregnancy. Mr. Ahmed and Mr. Jabir, they are asking for bilateral tubal ligation. And you have Ms. Noura is asking to have a baby. She's requesting for a baby. So, in real life, we get requests that may arise issues with others, individual, spouse, parent, children, friends, and neighbors. Okay, local community, society, culture, hospital policy, state law, global view. So people will be pulling from different sides. Okay, what are the ethical issues in this consultation? Number one, the 4 different and conflicting requests. What about the doctor duty for all? You have duty for Noura, duty for Jabir, duty for Ahmed, and duty for Sami. What about the hospital policy for all? What about the land law? Qanun al-Balad. Your position as a resident under supervision, because this lecture was made for residents. Okay, dealing with 4 reflexed and doctor's-client relationship. Whatever you do, you are threatening your doctor's-client relationship. What about the patient and client rights? What about them when they conflict with other people's rights? What about do no harm, non-maleficence? What about doing good, beneficence? What about truth telling? What about informed consent? What about respecting autonomy and confidentiality of each party? What about justice for all? I need contribution from the participants. We have 28, 25, 26, 28 participants. Anybody have views on how to apply all of these? The requests, doctor duties, hospital policies, a land law, your position as a young doctor or a resident, and so. What about how would you do? Can anybody answer me?
هذا كده اسمه شنو؟
Hmm?
ايوه ايوه دكتور عصام السلام عليكم.
عليكم
again
السلام.
again
تفضل.
ايوه انا الحقيقه معايا اسم شنو؟ with me my brother-in-law son. He's a doctor. He's doing his internship here with us in Riyadh. And I asked him about the dilemma concerning the disease of the woman, actually, gonorrhea infection. And he talked about, he's a very intelligent doctor, actually. And he told me that the most important thing that I should be very keen about the confidentiality and the responsibility then will be I should tell her all about her disease, and then if she is going to tell her زوجة, her husband, that is will be the matter for her, up to her. But I don't know whether this is the right thing or not. So we need your consultation, actually. Thank you.
Actually, I have a collection of answers here. I can tell you what answers which was given by somebody. Okay. He said to me that I don't want to disrupt the family and I won't treat the mother. I will treat the wife, okay, and the mother, and I will investigate her and do everything. And then I will tell her, what you got is something like common cold. You know, he tells her, your gonorrhea is like common cold. We don't ask why common cold happens to people. It just happens like that. This is what he said. And he said, without telling her, he will do uh, all the tests for syphilis, for gonorrhea, for HIV, and he will do it several times, okay, without telling the patient. And his aim is to preserve the family and to let the husband to escape away from being punished by his wife. But if you go for further things that, and if she comes later on to sue him and tells him, you cheated me and you did a lot of investigations for me for HIV, and you did for me 3-4 times, and you did test for the child when he was born, and you tested me for syphilis without telling me, then the doctor will be in trouble. And he may say, I wanted to preserve your family. I don't want you to get problems while you are pregnant, and I don't want you to get depression when you are pregnant. And then he will be in trouble. The doctor will be in trouble. And if she sue him, he will not get out with it. Okay. And some other people will um, talk to the husband and convince him, please go, confess to her, talk to her, ask for forgiveness, because when I see her, I'm going to talk to her. Definitely, I'm going to breach the confidentiality based on the law of breaching confidentiality, because we have three legal obligations to breach confidentiality. Number one is a court order from the judge. Number two is the safety of other recognized persons. Number three is public health interest. Okay, so this is affecting number two, which is definite harm to two persons, that is the mother and the child. So we go and breach, and we will be completely legally and ethically protected by the law. And the husband, let him go wherever he goes, because we are not supposed to cover his mistakes, his unlawful behaviors. We're not supposed to do that. Okay, this is so I gave you two approaches now. One the legal one, and one was the one who was trying to compromise things. Okay, right. Let us go back. This is okay with you?
Thank you.
And with your nephew there?
Yeah, thank you. Thank you. Thank you, doctor. Thank you.
Okay. Okay, anybody would like to talk about this? How are we going to handle this? Okay, for the sake of time, we'll go forward. How do we describe this situation? This is a situation of real dilemma. Okay, the dilemma is affected by the philosophy, Hippocratic oath, the teleos, the final purpose approach, and the duentas, the professional obligations and commitment approach. We have the tradition, we have the human morals, we have the culture. All of these are embedded in this case, okay? And we have the religion, we have the secularism, العلمانية أو العالمانية also. It may come up of personal values and the land law قانون البلد. For a profession to be respected, ethics should be learned, well promoted, practiced, and applied with high level of excellence. Ethics deals with relationship and actions between doctors, patients, family, society at large. So public relations and communication is very important in this area. Okay, medical ethics is about the professional standards, the behavior of staff. And here, our behavior is immediately affected, will be affecting the life of this family. Okay, in ethics, we have justice, equity, and fairness. We have to apply this to everybody here, and we have to respect every person coming to us, and we have to go for beneficence and non-maleficence. Okay, so we have to give beneficence and maleficence to the three parties coming for request, Mr. Ahmed, Mr. Jabir, and Noura. And we have to be fair and just with all of them. And we have to respect for person for all of them. Okay? And all of these should come. Also, we have to respect the hospital policy. The land law and the international law sometimes applies. Some issues that comes to us, we need to have it in detail. We have the 7 options, which we just mentioned. Okay. Do nothing. Use the grandmother. Can we do nothing in the previous ethics? We tell them, no, I cannot do anything for you. Please go home and sort it at home. Can we do that for Noura or Mr. Ahmed or Mr. Jabir? I don't think we can do that.
No.
Can we tell them, please go and talk to your mother and grandmother and let them solve your problem?
No, also.
Okay. Can we ask them to take some medications to help the pregnancy or the next pregnancy to be normal? Okay. Can we use calm or lifestyle changes so that we get a healthy baby next time? Okay. Can we do that? I think we should consider this. Oh, yes or no, this should be to adult, children, elderly, the confused, the persistent, and women. Also, women have rights to have their options and their choices. Okay, decision-making capacity. What about Noura? Noura, is she have the ability to make rational decision on medical treatment options? Does she have the capacity? If we go for a sliding scale, what about her mental capacity test? Okay. A patient may have ability to understand and make decisions about some treatment options, but not about others. A comfy patient, very famous story in UK. There was a patient who had schizophrenia and he had diabetic septic foot, which was decided to go for amputation. And when they came to do that, he said to them, I have schizophrenia, but I would like to die with more my organs than live with amputated leg. And the doctor said, I cannot operate on him and I don't want to let him lie. Let us raise this case. And they raised the case and they called the judge to come to the prison at night. And they had the case and they decided that his mental capacity is okay at that time, and so his choice was respected. What about children and the elderly, the confused, and the women? They all wish to go for decision-making capacity before deciding. And when we apply this to Noura now, okay, Noura is near to normal, is high functioning, and her mental capacity is acceptable. So we should respect her choice. What to breach confidentiality? Should we tell them that she is not pregnant now because she had her cycle 7 days ago? Or should we tell them that now, for us, she's not pregnant, You can stop talking about pregnancy now and start talking about bilateral tubal ligation. So think of breaching the constitution. There is always legal regulations, and there are three exceptions for it: concern for safety of others, and concern for public welfare or court orders. These are the three places when we can breach confidentiality. Okay, the police. If the police comes, he have no right to do that. If he wants something, he should go to court, bring court orders. This is international. Look, only we respect the court, not the police. Medical ethical ethics and law, we have the informed consent, refusal of treatment. Nora, can she refuse to have bilateral tubal ligation? Okay, number two, the clinical relationship, truthful, trust, and good communication. What should I tell each party so as to be truthful? Confidentiality and disclosure, medical research. Is this a case for medical research? What about human reproduction here? There is an issue of testing the next child in utero, and if he is again having Duchenne muscular dystrophy, we can go for termination of pregnancy or abortion, and this is an ethical issue. Also, it needs an ethical committee decision. Okay, and also the new genetics now, they are there. We can screen we can let her to get pregnant, and then we screen the baby. If he is normal, we let him to complete his life and come out as normal, because this child of Duchenne is going to die. Most of them died in the teenage. Okay. Okay. What about children? Okay, mental disorders, disabilities, as Nora case, life, death, dying, and killing issues when she have another child. Vulnerability. What about the doctor? Is the doctor going to have if he just did what they want? Okay, and they all somehow forced her. They gave her sometimes she got sleep. They put her in. They do tubal ligation on her, as it has been done sometimes early. And resource allocation. What about it? And the rights of each people here. What should we do? The worst thing to do for a doctor's life is to learn ethics in an appeal or in a court. That's what the worst thing that can happen for the doctor to go to the court and then to face his ignorance there. The lawyers will put him, in a very bad situation, and they will give him very hard words. Okay, so what we need, we do here, we need to learn some knowledge and understanding of ethics, and we need to know critical thinking and ethical awareness, and we need to know some skills to handle ethical dilemma. Okay, we want people to go around, read, and then see you on our next workshop about ethics, which we are going to be held in Qatar Cancer Society, and it's going to be, I think, in 2 to 3 months' time from now. Hopefully to meet you there. I will leave you here, and I will open the door. I just want to read the charts. Okay, sorry about that. The recording is available on protecting the patients, being transparent, autonomy. Yes. All right. Any questions before we let the people to conclude? If anybody has any questions or anyone wants any elaboration in any point, I just gave you example of how to handle a dilemma that is for Nora.
Yes, Mohammed, please.
Yeah, Mohamed Bella, I think he's raising his hand.
Assalamu alaikum wa rahmatullah. Thank you, Dr. Isam, for the interesting presentation, and for Dr. Mohamed also. I have just quick questions regarding the scenario. So, Dr. Isam, you have mentioned the scenario that the doctor is already a resident. So, what is the obligation here for the resident because he might deal with the challenging ethical dilemma. And the question here, does he or should he refer to his consultant or the attending physician at the beginning before do any kind of intervention or conversation with the patients and the family? Thank you.
شكرا جزيلا حياك الله. Thank you very much. Resident is somebody is in a learning life. His life is for learning. Okay, this is the resident. If he has a case like this, okay, he should be interrogator. He takes the maximum amount of information without giving any decisions. Okay, so he collects the information, collects the data, the ideas, the concerns, the expectations, the fears, the effect of all of these problems on these factors. Okay, the ideas, okay, the concerns, the expectations, and the fears, and the effect. Okay, he should do this, collect the maximum amount of information, and he tells them, I have to review, your case is very important to me, I'm going to review it, and I'm going to talk to my seniors, and we will come to you with the best solution that we can make. And we'll try to do the best for all of you. This is what a resident should do. Okay? He should not escape because this is a learning opportunity for him. Okay? And he should be in greed for learning. See? This is what should a resident do. Any doctor can do this because this is a chance for him to learn what's going to happen. And when somebody comes to you and puts you in this condition, you do this, the ideas, the concerns, the expectations. Okay, this is from Mendelssohn, and the fears and the effect. Okay, and this is from, I think, Peter Tate. Peter Tate. These are people who studied the communication very well of the Royal College of UK. Okay, so when you have all of this, then later on you take this to the ethical arena, like what I showed you here. Can put it again. When you have too many requests coming from too many people. Yes, here. This one. You can see it? You can see my screen? What to do in this?
Yes.
So this is the area where the resident should work. Okay? Actually, I took this to the residents to discuss it with them in Mohamed Medical. I usually give it in my teaching. It gives them lectures on ethics. So I put this dilemma for them and let them to work. And they are now putting it on artificial intelligence to get answer. But AI did not give them the answer. Okay. Any more questions?
السلام عليكم.
عليكم السلام.
دكتور عصام كيف الحال؟ ذا اودينس مهدي.
مرحب.
الله يحييك الله يسلمك. نحن طبعا في مجال الباثولوجي في اشكاليه كبيره جدا من ناحيه الethicality. I think this is a big topic which should cover يعني all the specialties. And I would prefer if you even يعني extend it to all the specialists, because now we are suffering of ethicality and the relation between the doctor and the pathologist and the lab also, and the patient and the lab and the patient and the doctor, because there are many open areas where people are breaching this in an unethical way, because usually the request should be a direct message between the requesting doctor and the pathologist. But we are suffering. We are asked a lot of questions, and there is a big breach in this issue. Our colleagues usually intervene between the treating physician and the patient. So I hope that this topic will extend in the future to touch this issue. And I thank you very much for this very informative lecture, and I learned a lot from it. Usually, I think in an ethical way, but I think there are many things which are not being put in our thinking as to be part of the solution for such cases, especially when we were residents and treating physicians before being pathologists. Thank you very much.
Okay, thank you, Dr. Mahdi. Jazakallah khair. I think about 3 weeks ago, we had a workshop on interprofessional education of ethics. Because of this kind of problems that happen between the lab, the pathologists, the lab technicians, the patients, and the doctors, okay, and the intersection between the relationship and the mishandling of the things, and also about consultation of the pathologist. What test should I do? Some doctors ask for certain tests which might not help the patient. It's just waste their money and waste their time and waste their tissue. Okay? Should a doctor consult a pathologist in a multidisciplinary team before asking for specific tests or pathological tests or procedures or whatever it is required? Should that happen or not? I think now the medicine is going for the interprofessional education of everything, including ethics, and is going for the multidisciplinary team approach, especially to the complicated cases, because no one single doctor can take all the decisions for a complicated case of a patient. So if doctors are going to work together, they should work with ethics of working together. And this is now very well known as interprofessional ethics. And we had a workshop, our SODAC, our society, has asked me to do these workshops, and I did it, I think 3 weeks ago. And I'm ready to do it again and to include more new problems for me. Your contribution will be learning for me. It will be a learning opportunity for me. So I welcome that, inshallah. And I will add it to my hard problems, interprofessional problems in my previous workshop, but I will add the pathologist. We know that people in the lab sometimes breach the results. Who should tell the patient about his result? Is it the training doctor or the requesting doctor or any doctor or the lab technician or the lab pathologist? There is an issue in this area which we need to tackle it ethically and agree on it. And also hospital policies are there, landlord is there. Okay, societies is there. American Society of Pathologists, they have a lot of publications in this area. We can go to that, and science is endless. Thank you, Dr. Mahdi, again. Any more questions?
Any more questions before conclude? Thank you very much, Dr. Isam and Dr. Mohamed, for this comprehensive, detailed presentation. I think it tackled such a big topic in a very simple, still concise way. So thank you very much. I'm sorry, I'm having flu, so my voice is a bit turbulent.
شفاك الله وعافاك إن شاء الله.
اللهم آمين وإياك. جزاكم الله خير. So
Just to
if
conclude,
if no more questions, so on behalf of Sudaq, I would like to thank Dr. Isameldin Abdelbagi and Dr. Mohamed Hashim for their time and for their efforts. And as Dr. Isam has mentioned, we'll have a sort of a second part of this presentation, which is focusing mainly on the medical legal implications. And that will be during the SUDAQ Primary Care Annual Symposium that will be held on the 6th and 7th of February, inshallah. The announcements for save the date will be released soon, inshallah. So thank you very much and have a good night, everyone.